Hey everyone, and welcome to The Explainer. I am absolutely thrilled to have you here today because we are going to unravel one of the most incredible, mind-bending anatomical puzzles in the entire human body. Have you ever stopped to actually wonder how a baby's heart manages to pump blood before it takes a single breath? I mean, it's an astonishing feat of biological engineering. Before birth, a fetus is completely submerged in a fluid-filled environment, which means the standard way we adults get our oxygen, that simply isn't an option. So today, we're going to explore the hidden mechanics of fetal circulation. We'll look at the ingenious workarounds and bypasses that keep a fetus alive, and we'll also dive into what happens when those temporary systems stick around a little too long.
To really get this, you have to realize there is a stark, almost shocking physical contrast between the lungs of an adult and the lungs of a fetus. Think about adult lungs for a second. They're rosy pink, they have this incredibly spongy texture, and they actually crepitate, which is a fancy way of saying they make a crackling sound when you touch them because of all the air inside the alveoli. Oh, and if you put them in water, they float. But fetal lungs, totally different story. Because they haven't drawn in any air yet, they are perfectly solid. They do not crepitate. If you place them in water, they would literally sink right to the bottom like a rock. This very tactile physical reality is the roots of the entire puzzle we're solving today. If the lungs are solid and filled with fluid, sending blood to them to pick up oxygen is, well, completely pointless.
So, here is our roadmap for the explainer today to figure out how the body handles this. We'll start with number 1, the adult double pump. Then, 2, the fetal oxygen problem. From there, 3, bypasses in the fetal heart. After that, 4, the first breath. And finally, number 5, when bypasses stay open.
All right, kicking things off with section 1, the adult double pump, focusing on our baseline heart function.
To truly appreciate all the fetal workarounds, we really need to establish exactly how our hearts are functioning right now, as adults. Functionally speaking, your heart is not just one big pump. It is 2 distinct muscular pumps working side by side. You can trace the path of these 2 circuits pretty easily. The right pump handles pulmonary circulation. It takes in deoxygenated venous blood from the body and pumps it directly into the lungs, where it dumps carbon dioxide and picks up fresh oxygen. Meanwhile, the left pump handles systemic circulation. It receives that freshly oxygenated blood from the lungs and forcefully propels it out to the rest of the body. You might even remember that the muscular wall of the left ventricle is way thicker than the right. That's simply because the right side only has to push blood through the low-resistance lungs, while the left ventricle, it has to pump blood against the high resistance of your entire body.
So just to summarize our baseline really clearly, the right pump's sole purpose is to pulse deoxygenated blood to the lungs to fetch oxygen. The left pump's job is to propel that oxygenated blood everywhere else. Keep this dual system firmly in your mind because it sets up exactly why a fetus requires a radically different system to survive in the womb.
Moving on to section 2, the fetal oxygen problem, dealing with breathing in fluid.
Okay, let's transition back in time into the womb. I want you to really think about the anatomy we just covered. If the entire job of the right pump is to send blood to the lungs, what on earth is supposed to happen when those lungs are completely solid, unexpanded, and filled with fluid? Pumping a massive volume of blood into solid organs would be incredibly disastrous and inefficient. Plus, the fetus is getting its oxygen directly from the mother via the placenta, not from its own lungs anyway. So the fetus faces this massive logistical hurdle. How do you get that oxygen-rich blood from the mother out to the fetal body without wasting precious time and energy routing it all through the totally useless, solid fetal lungs?
Which brings us perfectly to section 3, fetal heart bypasses, the brilliant biological solutions.
To solve this oxygen problem, the body evolved these brilliant biological solutions hidden deep inside the fetal heart. It basically operates like a microscopic embryonic traffic control system. Oxygenated blood from the mother surges up through the inferior vena cava or the IVC, but instead of just letting it fall into the right ventricle to be blindly pumped to the lungs, there's a rudimentary structure called the valve of the inferior vena cava, also known as the eustachian valve, that acts as a guide. It expertly diverts this oxygen-rich blood straight across the heart, right through a specialized little hole in the atrial wall called the Foramen Ovale, and dumps it directly into the left atrium. Boom. From there, it can be pumped out to the body. Meanwhile, the deoxygenated blood coming down from the fetal upper body via the superior vena cava is carefully directed by a tiny bump called the intravenous tubercle, straight down into the right ventricle.
Actually, wait a second. If that deoxygenated blood goes down into the right ventricle, isn't the heart just going to pump it straight to those solid lungs anyway? Well, this is where the ultimate bypass comes into play, the ductus arteriosus. This is a short, incredibly wide channel that acts as an anatomical emergency exit.
When the right ventricle squeezes and pushes blood into the pulmonary trunk toward the lungs, the ductus arteriosus simply catches it. It connects the pulmonary trunk directly to the arch of the aorta, so any blood that accidentally makes its way toward those solid lungs is immediately diverted away and dumped straight into the systemic circulation. It is an absolutely flawless workaround for an environment without air.
And now, Section 4, the first breath, and closing those bypasses down.
As amazing as it is, this flawless system has a strict expiration date. The exact moment of birth requires a dramatic, instantaneous physiological shift. The baby takes its very first breath, the lungs suddenly expand with air, they become spongy, and boom! Those fetal bypasses must rapidly close down so the standard adult double pump system can immediately take over. And what's wild is that the physical structures that saved your life in the womb leave physical ghosts behind in your adult chest right now. The Foramen Ovale, that little hole between the atria, it shuts tight and leaves a shallow oval depression called the fossa ovalis. And that wide emergency exit channel, the ductus arteriosus, within weeks of birth, it anatomically closes right up, turning into a fibrous cord known as the ligamentum arteriosum. You are literally walking around right now with the monuments of your fetal circulation permanently etched right into your heart.
Finally, Section 5, when bypasses stay open, looking at the clinical consequences.
But, as we know, human anatomy isn't always perfect. We have to shift to the medical stakes for a moment and explore what happens when this intricate biological closure system fails to do its job after birth. It's a hugely important question. What happens if the baby breathes, the lungs become spongy, but the traffic controllers of the womb just absolutely refuse to shut down? This is where we see the real-world clinical stakes of congenital heart anomalies. A failure in this transition can lead to some severe mechanical and pressure issues in a growing child.
There are two primary conditions that really highlight this. First up is a patent ductus arteriosus. This happens when that wide emergency channel connecting the pulmonary trunk to the aorta fails to close anatomically within the normal 4 to 12-week window. It just stays open, meaning oxygenated and deoxygenated blood start mixing, which puts an enormous strain on the heart. Then we have coarctation of the aorta. This is a congenital narrowing of the aorta, often located right near where the ductus arteriosus attaches. Think of this narrowing like a nasty kink in a garden hose. The clinical signs for this are fascinating and they're highly specific. Because the blockage is located after the arteries that branch off to the arms, but before the arteries that go down to the legs, patients present with high blood pressure in their upper limbs, but terribly low, sometimes completely unrecordable blood pressure in their lower limbs. This also causes what we call a radiofemoral delay, meaning if you were to feel the pulse in their wrist and their groin at the exact same time, the groin pulse is noticeably delayed. You'll even see notching on the lower borders of their ribs on an X-ray. Why? Because collateral arteries dilate and engorge to try and bypass that blocked aorta, and they physically rub away at the bone over time. Unbelievable, right?
So the crucial danger zone for all of this is localized directly at the arch of the aorta. Picture the ascending aorta rising up from the heart, with the branches taking off to supply the head and the arms. Right after that left subclavian artery is the exact site where the ductus arteriosus connects and where that problematic narrowing, the coarctation, typically occurs. A tiny anatomical remnant in this exact spot causes massive systemic pressure differences across the entire body. It perfectly explains why a patient might have severe leg cramps from walking but simultaneously have dangerously high blood pressure in their arms. It all comes right back to how the fetal plumbing was originally routed.
It truly is a marvel of biological engineering. From having completely solid lungs to operating the adult double pump, the human body's ability to adapt on the fly is just staggering. I want to leave you with this final thought. Do you realize the remnant of your very first heartbeat's bypass is still sitting inside your chest right now? The fossa ovalis, the ligamentum arteriosum, they are silent testaments to the incredible, complex journey you took before you ever even breathed the air. I really hope this explainer has left you in awe of your own anatomy and curious to discover even more about the hidden mechanics within us all. Thank you so much for joining me today and keep exploring.